We are going to perform 5 mobility exercises for the hips, starting with the butterfly position with your back against the wall for support. It's going to allow you to get into your deep end range of external hip rotation with also knee flexion. From here, we're going to focus on breathing. We should feel a good stretch in the adductors, or the inside of the muscle tissue and connective tissue inside of the legs. Just focus on breathing. Inhale for 4 and exhale for 8. Just relaxing into this position. After about a minute, we're going to begin our pals contraction. And when we do that, we'll start pressing our hands into our knees and knees into our hands. After our pals contraction, we'll begin our rails contraction. At that time, we'll pull our knees toward the ground actively. From here, we can start our pals contraction. Press the hands into the knees into the hands, 10%, 20%, 30%, 40%, 50%, 60% to your maximal, greatest, and safest effort. Hold it. Keep slowly progressing. 5, 4, 3, 2, and rails contraction. Hands out front and pull your knees to the ground actively as hard as you can. Keep everything nice and tight. Keep pulling the ground actively. 3, 2, 1, and go ahead and relax and just breathe passively here. We're going to slowly transition to our next pals and rails contraction. So we're going to go into the bear position. Knees are bent about 90 degrees, dorsiflex the feet. Noticing that I'm using the wall again. I get deeper in my hip external rotation when I do this. I get more of a stretch, and I focus less on my back. Inhaling for 4, exhaling for 8 here. I have a good grip on my ankles, and I'm focusing on my breathing. During your passive holds, you just want to let the tissue know that you're able to sit in this position comfortably. If you're not able to do that, lower the amount of time. When we begin our pals contraction, we'll press our knees into our elbows and elbows into our knees, and we'll feel the same tissues being stretched and maybe some more. We're going to use our feet, ankles, shins, and knees, and our upper thighs to contract the muscles. Begin at 10%, 20%, 30%, 40%, 50%, 60% to 70%, all the way to your safest and greatest effort. Hold it. 5, 4, 3, 2, and 1. From here, we're going to push our hands forward and start our rails contraction. We're going to try to get our knees toward the ground as hard as we can, actively, for 5, 4, 3, 2, 1, and go ahead and relax into your passive stretch. Now from bear position, we're going to go into our sleeper internal rotation stretch. This is a great stretch. This is one of my favorites. And as you see here, I'm utilizing my left hip for the internal rotation to start. I have a lot of neurological feedback here, so I have to be real careful, and I have to actually put my hands all over the tissue to help the passive hold here. So you can do the same. I'm going to hold and inhale for 4, exhale for 8. Just focusing on my breathing here. So basically you're in the bear position, and then you just internally rotate one leg, and you try to keep the opposite knee and hip in that bear position. I really, again, like using the wall for all 3 of these mobility exercises. I think it's good to try it with and without the wall. So this is the hip sleeper internal rotation. We're just breathing and holding here passively. And then our pals contraction, we'll press our hands into our knees and knees into our hands. We're going to start at 10%, 20%, 20 to 30, 30 to 40, 40 to 50, 50 to 60, and then 60 to 100% of your safest and greatest effort here. Feeling big stretch. Keep going for 5, 4, 3, 2, and rouse contraction. We're going to bring our arms toward the wall and try to actively press our knee further into internal rotation, or our hip into internal rotation. Keep going for 3, 2, and 1. We'll go back to our passive stretch. Remember that during your pals and rouse contraction, you're slowly amping up in your pals and you're holding your rouse at 100%. So you should still be at 100% in your rouse contraction. Muscle recruitment is huge, so that's why we always talk about irradiation or full body muscle recruitment or bioflow. Here we have internal rotation on the opposite hip. I have a little bit more mobility on this hip, so I'm not using as much feedback with my hands. Before, I had my hands all over that hip because there was just a lot that needed work there. You can talk to an FR practitioner if you have some major hip issues in internal rotation. Here we're passively stretching, inhaling for 4, exhaling for 8. In internal rotation in our hip sleeper stretch. Focusing on our breathing here, just trying to relax in this position, getting ready for our pals contraction. From here, press our hands into our knees, knees into our hands, the outside of the knees, 20%, 30%, 40%, 50%, 60%, 70% effort. We're going to go from 70 to your safest 100% effort, as much as you can here, for 5, 4, 3, 2, 1. From here, rouse contraction. Actively bring your arms to the wall. Try to go deeper into internal rotation of the hip. 5, 4, 3, 2, and slowly transition out and go back to your passive transition. And from here, just holding that actively, or after that position, we want to passively hold it and then slowly come out. The last series of stretches are 90-90 hip hinge. So we're going to start in the 90-90 position, and we're going to press firmly into the ground with our hands as we open up the back hip. And after about 5 to 10 hip hinges, what we'll do is I'm going to try to go from 90-90 on one side to 90-90 on the other side. So it's going to become a 90-90 transition. So what I'm going to do is, noticing that I'm opening my foot all the way up at the end, and then when I go through my transition, I'm going to see if I can try to keep my opposite knee on the ground. So continue trying to open up the hip here in this hip hinge position. And now we're going to turn this into more of an active transition. From here, we're going to go into our hip hinge, squeeze those arms, irradiate, squeeze everything, and slowly from here, hip hinge, and slowly until you have to bring the opposite knee off the ground and try to transition all the way into your 90-90 on the other side, and trying to really make sure that everything's lined up when you get over there. Once you're all set, you're going to go back to that hip hinge on the opposite hip. I really like to connect my foot into the ground during this. This is an active external rotation there, and then internal rotation on the way down. You can perform these, before or after exercises, and we're going to transition all the way into bear here. Squeezing the fists, slowly open until you need to or have to bring the opposite knee off the ground. And that's it.